Special needs parents. Let me ask you a question. Do you know the difference between SSI versus Medicaid? Because they are not the same thing. And understanding the difference could make a huge difference when you're trying to get your child the services and support they need. Hey parents, Nurse C here. I'm a registered nurse with 20 years plus experience as a pediatric nurse, emergency room care nurse, and currently as a bilingual case manager for an insurance company. And I'm also the mother of a beautiful special needs daughter that's 23 years old. She's blind, developmental delays, and autistic. Welcome back to Medicaid Mondays, where we're breaking down some of the programs and resources that special needs families need to know about. Today, we're talking about SSI versus Medicaid. Let's start with SSI, which stands for Social Security Income. SSI is a federal program administered by the Social Security Administration. For a child, SSI can provide a monthly cash benefit when the child meets the Social Security disability requirement and the applicable income and resources requirement. And here's something important. Just because your child has a diagnosis doesn't mean that they automatically qualify for SSI. So the Social Security Administration, they look at how the child functions, their medical condition and how they function. Along the side, their financial eligibility rules, which they go by the parents when they're under 18. So if your child is under 18 and they may qualify for SSI, but if the parent that takes care of them makes more than you know, the threshold line, then it's possible they may not qualify. And that happened to me. SSA confirms that children can qualify for SSI when they have a qualifying disability or blindness and meet the applicable income and resources requirements. Now let's talk about Medicaid. Medicaid is a health coverage. It could help pay for things like health care, doctor's visits, medication, hospital care, prescription, and some other medical covered services. And especially for those child with special needs, Medicaid can become super important for them. Because depending on the child's eligibility requirements and your state's program, Medicaid may provide access to services that special needs families really need. But here's where it gets confusing. Medicaid eligibility rules are not the same in every state. Your state determines many of the rules and processes for Medicaid eligibility and enrollment. So let's make this really simple. SSI equals cha-ching. It provides cash money assistance to eligible child. And Medicaid is for the medical coverage. Medicaid helps pay for the doctor. They can work together, but they're two totally different programs. And here's the part that every special needs parent really needs to hear. Your child can potentially qualify for Medicaid even if they don't receive SSI. And in many states, receiving SSI can make a child eligible for Medicaid. But the exact processes depends on each state. SSA specifically notes that in most states, SSI recipients may automatically qualify for SSI. SSI recipients may automatically qualify for Medicaid, while in some other states, Medicaid has to be applied for completely separate. In New York, it's like that. This is one of the biggest things that I want parents to understand. Don't automatically assume that if your child doesn't qualify for SSI, that they won't qualify for Medicaid. Medicaid has multiple eligibility pathways, and the rules, they vary by every state. There may be also programs designed specifically for people with disabilities or significant medical needs. So if you've been told that you don't qualify for SSI, don't stop there. Just ask, what Medicaid programs could my child qualify for? And ask your state's Medicaid agency about disability related issues or about disability related Medicaid programs, waivers, and other eligibility pathways. If you're raising a child with special needs, here's what I want you to do. Number one, find out where your child has been evaluated for SSI. Number two, apply for Medicaid or contact your state's Medicaid agency to find out what programs your child may qualify for. Number 3, ask specifically about Medicaid waivers and disability related programs. And 4, keep your paperwork, medical records, therapy evaluations, school reports, diagnosis, medication lists, hospital records, documentation on how your child's condition affects his daily functioning can all be important when applying for benefits and services. So don't be afraid to ask the questions. You are your child's advocate. Remember that. And to the parents, I know this can be an overwhelming process. You already have tons of appointments, therapies, school meetings, medication, paperwork, and everything else. So if you're sitting there thinking, I don't even know where to start with one question only. What program does my child qualify for? You don't have to figure everything out in one day, in one phone call, or one application. Just one question at a time. If this video helped you understand the difference between SSI versus Medicaid, save this video and share it with another special needs parent. And tell me in the comments, what's the biggest question you have about Medicaid? I may answer your question in the next episode of Medicaid Monday. And make sure to subscribe to Nursey here because we're going to continue breaking down Medicaid, SSI, waivers, insurance, care coordination, and other resources for special needs families. I'm Nursey. I'm a special needs mom, and I'm here to help you navigate the system, advocate for your child, and feel a little less alone. See you next Monday. And remember, your health is the real flex.